Good evening, everyone, and welcome to this very first edition of the GSMH Webinar Series, organized by the Global Society of Medicine and Health. Some of you know already, my name is Ahmad Bek. I'm the president founder of GSMH, and I'm truly glad to see so many of you here tonight. The purpose of these webinars is simple, to connect medical students and doctors worldwide to learn from each other's experience and open new paths to our future career. Tonight, we have the pleasure of welcoming Dr. Ahmad Jamal Bek, MD, Research Assistant and first-year internal medicine resident in the UAE, who will share with us his journey and insights on the road to medical residency in the UAE. The session will last about 45 minutes to 1 hour, followed by Q&A. So feel free to raise your hand or use the chat at the end of the presentation to ask your question directly to the doctor. Once again, thank you all for joining, and thank you, Dr. Ahmad, for being with us today. Before we begin, I'd like to give the floor to Marwan, our GSMH Georgia branch director, so he can officially present and open the session. After that, we will move on to Dr. Ahmad Jamal Bek presentation. Thank you.
Thank you, Arman. So just again, welcome everyone. So I would like to introduce Dr. Ahmad Jamal Bek, who grew up and was raised and finished high school in UAE. And then he moved to pursue medicine in Georgia, University of Ivan, in Tbilisi, University Ivan State University. Then after he graduated, after 6 years, he completed his internship at Barjeel Hospital in Abu Dhabi in UAE. And he is currently working as a research assistant at UAE University and Sheikh Shakhbout Medical City. And then is right now also a first-year resident at Barjeel Hospital. Welcome, Dr. Ahmed. The floor is yours.
Thank you so much, Dr. Marwan, for this kind introduction, and good evening, everyone. It's my pleasure to be here with you all today. Just before starting, I just want to mention that the main monitor is going to be facing straight ahead here. So after this brief introduction, I'll be looking slightly to the side so I can start presenting my slides. So again, good evening, everyone. I'd like to begin by thanking the Global Society of Medicine and Health for giving me this opportunity to present today. So again, my name is Dr. Ahmad Jamal Bek. I'm a first-year internal medicine resident, as well as a research assistant in UAE University and Sheikh Shakhbout Medical City. Today, I'll be discussing an important topic that many medical graduates are seeking to understand, which is the road to medical residency in the UAE. In this session, I'll walk you through the step-by-step process, starting from completing your medical degree, applying for the internship, taking the Emory exam, and finally the residency application and the matching process. I'll also share some key insights about the course, timelines, available specialties to help you with your pathway more confidently. Again, a really quick brief background about myself. Upon completing high school, I've decided to pursue medical school in Georgia and in Ivan Jahovashvili Tbilisi State University. After completing 6 years of medical school, I've managed to apply and match into the internship program in Barjeel Hospital in Ain City. And after completing 1 year of internship, I managed to transition into a research assistant position in UAE University, as well as Sheikh Shakhbout Medical City in both the public health department, internal medicine, and nutrition department as well. So by the end of this session, I hope you'll have a clear understanding of the entire process of becoming a resident doctor in the UAE and feel more confident about taking the new steps towards your goal. So without further ado, let's get started. I'm gonna start sharing my screen. So please just let me know if you can guys see presentation clearly.
Everything is perfect. Thank you, Doctor.
Okay. So the main objectives that I want to go through in this presentation is the data flow verification, the ECE, the application of the internship, the licensing exam, which is known as Emory here in UAE, the residency application, and finally the matching and training process. So moving really quick, it's extremely crucial for you guys to be aware of the regulating authorities here in the UAE that are in charge of regulating the residency program and medical education training here in UAE. So we have 4 different regulating authorities. The first one is the Department of Health, which is known as DOH. It's the regulating authority in charge of the medical training in Abu Dhabi and Al Ain City, and this is the authority that I'm a part of. Moving on, we have two different regulating authorities in Dubai. The first one is Dubai Health Authority, which is also known as the DHA, and is in charge of the training in the private sector in Dubai. And then we have Hamad bin Rashid University, known as MBRU, which is in charge of the governmental sector training in Dubai. And lastly, we have the Emirates Health Service, which is in charge of the medical education and training for the internship and residency program in the remaining Emirates here in UAE. So, moving on, in this picture, I've summarized the whole process really quick for you guys to understand the pathway. So upon completing your MBBS degree or MD degree, you can go and apply for the internship straight ahead. After completing 1 year of internship, you can do your MBA exam and then apply for the residency. And then from there, you're going to move to the residency interview and matching. Just one thing that I would like to highlight here is in regards to the MBA exam. You don't have to finish the internship or even your medical school in order to be eligible to apply for the MBA exam. You can actually take the MBA exam at the end of your medical school or even during your internship or after completing your internship. So it's not a set rule. There is no set rule that says that you have to be able to finish both the MBBS degree and the internship to be able to apply to the MBA exam. You can take them either at the end of your medical school or during your internship or after completing your internship. Moving on, something that is extremely important to get rid of as soon as possible and as early as possible, which is the verification of your documents. So if you're planning to do your medical training here in UAE, whether that's the internship or the residency program, you actually don't have to verify any documents. There are two different organizations here in the UAE that are in charge and responsible for verifying the documents. The first one is known as the data flow. So the data flow is an organization or a third party that the regulating authority use so that they can verify all of your documents. So whenever you're planning to apply, during the application process, there's a certain website that you can go through within the application process on the website, and from there the data flow are going to ask you to submit all of your documents, the bachelor degree, transcript, and so on, and they're going to verify everything, and they're going to have a direct contact with the university that you graduated from to make sure that everything is verified. The same goes to the ECE. The ECE actually is an organization that's usually requesting your documents to be verified only from the Department of Health in Dubai and EHS, which is the remaining of the 5 Emirates here in UAE. And the cost for the data flow is anywhere from 1,000 dirham to 1,400 dirhams. It depends on the amount of papers that you're submitting, but the minimum amount is 1,000 dirham, maximum is going to be 1,400. For ECE, it's going to be just a certain cost of $255 for verifying all of your documents. So moving on to the first process that you're going to go through whenever you're trying to apply here in the UAE, which is the internship program. You can't apply to the residency program here unless you do 1 year of internship program in the UAE. So the first internship program, which is offered by the Department of Health in Abu Dhabi and Al Ain City, the application process usually begins at the 1st of March and it ends by the end of March. The required documents here, as you can see, a recent photo. For both UAE residency visa and the Emirates ID, it's not really important. If available, you can submit those documents. If you don't have them, then they're not really necessary. The application will go through and you're going to be ranked and even, if possible, picked up, and then you're going to work out the residency visa and the Emirates ID. Anything mentioned here in regards to UAE national is not eligible for you guys, so you don't have to worry about it. You can skip that. Moving on, you're going to need your resume, and then it says here at the last point, a proof that your degree was taught in English. This rule was deleted, from the whole eligibility required documents. So right now you'll have to take the IELTS, TOEFL, or even OET for you to be able to apply to the internship program. It doesn't work anymore if you submit a paper from the university saying that the whole degree was taught in English. You'll have to do the IELTS, and I think within the IELTS you'll have to score 6, and there are 4 different categories for the IELTS. I think it's listening, speaking, writing, and reading. So you'll have to score 6 in each of those categories, and a total of 6 for them to accept that, or either do the TOEFL or OET. And then obviously you're going to need your passport and the graduation certificate. For the graduation certificate, so let's say, for example, you graduated on 2025, you have only 2 years, and within those 2 years, you're only eligible to apply for the internship program. Let's say, for example, you graduated in 2025, and then you wanted to apply in 2028, you won't be eligible, and they will reject the application form. So you'll have just to just keep this in mind whenever you're planning to apply here in the UAE. They may request further documents, but this is usually only in rare cases. Usually this is the only document that they're going to request, only for the Department of Health. The other authorities have different documents that they're going to request. So there are some special conditions and criteria for them to accept the applicants. For example, you can see there within the GPA, for UAE nationals, there is no minimum GPA or percentage. For UAE graduates, a minimum GPA of 2.5 or a percentage of 75%. For international medical graduates, you'll have to get a GPA of 3.2 or above, or a percentage of 85% or above. For them to accept you. You can still apply to the application, but after the application ends, they're going to send you an email by the end of it saying that your application has been rejected due to you not meeting the special condition or criteria of having a GPA of 3.2 or a percentage of 85 or above. So I would say the Department of Health is the most competitive out of all other regulating authorities. So they really do emphasize having higher marks, whether that be for the internship program or even the residency application later on. So, but when it comes to the other regulating authorities, there is no criteria that says that you have to get a GPA of 3.2 or higher. You can still apply and you can still match. This is only for the Department of Health in Abu Dhabi. Now, when it comes to the cost for the internship program here in Abu Dhabi, they usually charge 30K in dirhams, which is paid in 4 different installments. So you can't also start the internship unless you pay the first installment. So you'll have to pay, I think, 7,500 dirham, and only after you can start your internship program. Now, moving on to the MBI, which is Mohammed bin Rashid University, and they're in charge of the governmental sector, medical education and training in Dubai. So they have obviously a different timeline. The application is on the mid of January, and it ends at the mid of May. There are interviews, cross-matching, and there are also the conditional admissional offers. So you can see there on the third point, the personal interviews for dental candidates. So what do they mean by this? For people who are applying for a dental internship, they'll have to be physically there for the interview. But when it comes to medicine, obviously you can do it on either Zoom or Teams. It doesn't really matter. You don't have to be there physically to do the interview. Moving on, again, they have their own identification documents or academic documents. I'm not going to go through them again. They're almost similar to each other. I can pause if you guys would like to take a screenshot or a picture of it. So yeah, that's all of the identification documents and academic documents that they're going to request from you guys. Now, moving on to Dubai Health Authority, which is known as DHA, they're in charge of regulating the medical education programs in the private sectors. Again, they have their own required documents, and the application process starts from the 10th of February until the end of March. And the medical training starts from August 2025. One thing that I would like to mention when it comes to the Dubai Health Authority, they're actually really flexible when it comes to the timeline. So they might say the application will be from the 10th of February until the end of March, but they might extend it even more, or they might even begin earlier. So you'll have to keep checking on the website. They'll keep updating it, and the same goes for the starting date of the training. They might say that you're going to start on the end of August or the 1st of August, but they might postpone that until September or October. So they're really flexible when it comes to the time, unlike the other regulating authorities. So if they say they're going to start on the 1st of September, you're going to start on the 1st of September. Now, when it comes to the application fee, again, it's going to be 30K in dirhams, and they're going to be paid in 4 different installments. Now, the last regulating authority for the internship here is the EHS, which is extremely important here. Just to mention that when it comes to the EHS, you're applying to 5 different emirates or cities, you could say. So they don't really tell you exactly which emirates you're going to be accepted to. You're only going to find out after getting accepted. So usually they're going to send an email to you with the acceptance at the end of July or August, and only then you're going to know which hospital you got accepted to in which emirate. They also have their own required documents. Only one thing that differs from all other regulating authorities, that you'll have to get a valid BLS completion card or a certificate for you to apply. This is the only regulating authority that requests this course before applying to the internship program. Obviously, registration is going to be different. It's going to be from the 1st of May until the mid of June each year. And they also have some different criteria here. So you have only 1 year after graduation to apply for the internship. After that, they won't accept any application from you. And the priority is always given to UAE national. This applies to all other regulating authorities, whether that be DOH, DHA, MBRD, or even EHS. The priority is always going to be given to UAE national. It's similar to all other countries, whether that be the US, UK, and so on. When it comes to the service fee, it's going to be also the same. It's going to be 30K in dirhams, and you're going to pay them in 4 different installments. Now, moving on to the portfolio evaluation. So what exactly they're going to look at whenever they're trying to pick applicants for the internship, and this goes to all 4 different regulating authorities. There is something known as the IFOM, which is the International Foundation of Medicine. It's an exam similar in structure to the USMLE, offered by the NBME, which is the National Board of Medical Examiners. So this is only important if you're planning to apply to the Mohammed bin Rashid University, which is the governmental sector in Dubai. They're going to give you extra score for it if you're applying to this regulating authority. In regards to all other authorities, they won't even look at it. They won't even give you extra score for it. So it's not really important unless you're applying for MBRU. Now, the other points that you should look at, which is the research activity and publication. So when it comes to research activity, you don't really have to publish anything. So it could be anything, maybe data analysis, data collection, different surveys, anything that you participated in that is related to research will count as a research activity, and you'll get extra points for it. When it comes to publication, obviously you'll have to publish some sort of paper, case report, systematic review, in a journal that is well recognized by the UAE, and you'll get extra scores for it. The amount of publication doesn't really matter. So let's say you have published 5 different papers and another applicant published only 1 paper, you're both going to get the same amount of scores. It doesn't really matter if it's 1 publication or even more than that. A presentation in a scientific event, let's say, for example, a conference, if you presented anything such as a poster presentation, let's say a topic in regards to something specific in the conference, you're going to get an extra point for it. Volunteering services and community activities. So they do really love the volunteering services, so such as blood donation, community wellness activities, all of those kind of things. They do really love those kind of activities to be included in your resume. Skill enhancement courses, this would be something like BLS, ACLS, even maybe an ECG interpretation course. All of those would count as a skill enhancement course, and you'll get extra point. And you'll get only points for 2 courses maximum. So you can only submit 2 courses, not more than that. So let's say, for example, you did BLS, ACLS, and even more courses. They'll only take 2 out of them, and they'll give you points for it. They won't give you extra points for any extra courses that you have done. And finally, the academic awards. So this could be, let's say, for example, an award for having the best poster presentation in a conference, for example, the highest GPA, for example, in your university, and you got an award from the university or even the conference that you participated in. This will count as a certificate and extra points for you whenever applying. So when it comes to the portfolio, those are the things that they're going to look at. Again, the I-form doesn't really matter unless you're applying to the MBRU. You're only going to get excess scores for it if you're applying to the MBRU. Now, moving on, after the internship will come the Emory exam, which is known as the Emirates Medical Residency Entrance Examination Service. So this is the exam that you have to take in order to do your residency here in UAE. It's equivalent to, I would say, the USMLE Step 2 CK exam in the US. So the regulating authority behind this exam is the NIHS, which is known as the National Institute for Health Specialty. And there are so many different eligibility and set rule of criteria that you have to be aware of whenever you're applying. So the first thing, the exam is open to all medical graduates and final year medical students. So as I mentioned earlier, if you're in your final year medical school, you can apply for the exam. If you're a medical graduate or even doing your internship currently, you can still apply for the Emory exam. So all eligible candidates may take up the Emory up to 3 times a year, starting from the first attempt to obtain a passing score. So let's say, for example, you applied for the Emory exam and unfortunately you couldn't pass on the first time. You can still do it in the same year, a second time, and even if you didn't pass on the second time, you can do it a third time. But after doing it for 3 times, and let's say, for example, if someone failed for 3 times in the same year, you won't be able to do the Emory exam anymore. One more thing to be aware of, let's say, for example, after obtaining a passing score in the Emory, they mention here that you're not eligible to further attempt to improve your mark. They actually reversed the rule here this year, so you can actually retake the Emory exam again and the same, actually not in the same year, the year after to improve your mark. So let's say, for example, you passed this year, but you wanted to improve your mark, you'll have to wait for the next year and you'll get one attempt just to improve your mark. Now, when it comes to the validity of the Emory exam, it's up to 2 years. It's similar to the IELTS. So let's say, for example, you did it in 2025 and wanted to apply on 2026 or 2027, you can still do that. It's still valid for 2 years. Now, moving on to the passing score. So in order for you to pass the Emory exam, you'll have to get 55 percentile or above, and then you would be deemed as passed. So you have a maximum of 3 attempts, and within 1 year, only if you failed on the first attempt. So you can't retake them 3 times. If you pass on the first time, then that's done. You only have 1 chance to improve your mark on the next year. And again, just as I mentioned, final year medical students are eligible to attempt the exam. The exam results are valid for a maximum duration of 2 years, just as I mentioned. Now, when it comes to the examination fee, it's going to cost you 1,000 dirham, excluding tax. I think with the tax, it's going to be 1,062 dirhams for the total cost of the exam. Now, moving on to the exam format. So it's 120 MCQ questions. The duration of the exam is going to be lasting 3 hours. One thing that you should be aware of also, that the marks are not going to be taken away from you if you answered incorrectly on any of the MCQs that are going to be given. So now those 120 questions are going to be divided into many different sections, which is going to be internal medicine, OB-GYN, pediatrics, surgery, family medicine, psych, and public health. So they're going to be weighted differently in each exam. Each exam is going to be different from one another. So, for example, you might get an exam that has more questions on OB-GYN, and let's say, for example, someone else took the exam on a different date. They're going to have maybe more surgical questions. So it depends. But usually, most of the questions are going to be internal medicine related. And I would say even 60% of the exams is going to be internal medicine related. OB-GYN, they would give at least 20%. They do focus a lot on psychiatry, so there are going to be at least 10 questions in regards to psych. And lastly, the public health. So in public health, it's going to be all ethically related questions. It's going to be things about autonomy, justice, the confidentiality of the patient. So those are going to be the public health related questions. Now, moving on onto the examination dates. So the dates are going to always be the same on each year. So you can do the exam on December, January, February, and March each year. So this is the most updated one for this year, for 25, and the next year, 26. So the first exam is going to always be on December, and you're going to have only one exam on December. And the examination date is going to be on the 21st of December. And the last one is going to be on March, and it's going to be on the 22nd of March. Now, a tip that I would like to give you guys is that try giving your exam as early as you can. So let's say, for example, the exam on December is going to be way easier when compared to the exam that's going to be on the end of March, or even the middle of March, or even February. So December is going to always be the easiest. January is going to be easy, but it's going to be way harder than December, and so on. And that's the pattern that they're going to move with. So try preparing as earlier as you can for the exam. I would suggest doing your exam on December. Actually, I did mine on December last year. So it's way easier when compared to the other months that the exam are going to be available in. So when it comes to the result date, here you can see, for example, you did your exam on the 21st of December, the result's going to be on 25th. The timeline isn't actually fixed. You can even get your result on the 22nd or 23rd of December. So, but maximum by the 25th of December, you're going to get your result. Now, for example, as I mentioned earlier, the residency application for the DOH, Department of Health, is going to end at the end of March. So let's say, for example, you took your exam on the 22nd of March, and for some reason the results weren't given out on the 26th of March. You can submit an official paper from the NIHS saying that you already did the exam and the results took some time and they're going to be out maybe, let's say, after a week or so, and it's fine. Your application is going to still go through and you will be able to apply for the match. Moving on now to the residency program application, which is quite different when it comes to comparing it with the internship. The internship is much simpler. When it comes to the residency program, it's going to be a little bit more complicated. So obviously, the first thing is doing your residency entrance examination, which is the Emory. After passing, the application will start on the 1st of March, and you're going to submit all of your documents. After submitting all of your documents, the interview booking schedule is going to start. So on the website, a notification is going to pop out asking you to book the interview for the hospitals and the specialties that you're interested in. And this is going to start on the 27th of April until the 3rd of May. After booking your interview, in case you got any interviews, you're going to do them on the 1st of May until the 8th of June. After doing the interviews, a submission of ranking order list. So you have to submit each of the specialties that you have chosen and the hospitals that you have did your interview in. So let's say, for example, you did your interview in Burjeel Hospital or Cleveland Clinic, you'll have to submit those, and only then the post-matching will start. The post-match is going to be at the 20th of June until the 23rd of June, and the final match publication is going to be displayed on the website on the 15th of July. So when it comes to the Department of Health, they won't send you an email saying that you got accepted. You'll have to go through the website, and there's going to be a big list, a huge list of applicants that got accepted. You'll search down, or if you scroll down, try finding your name there. If you found it, then congratulations, you have been accepted to the program. If you didn't find it, you'll have to wait, because there is also a waiting list. Some people might get accepted somewhere else and they'll choose to go to their residency there. So if you're ranked as a first or second in the waiting list, you might get accepted later on in the residency program. And then after that, they're going to start with the licensing process, contract, and so on. And usually, the 1st of September is the date that the internship and the residency program starts in the Department of Health. So they're going to obviously need different required documents for the residency application. Everything is listed here. Again, I won't go through everything, but for you to be able to apply, you have to get an internship certificate, or you have to complete your internship. Not necessarily in the UAE, but if you did your internship anywhere else other than the UAE, then you have to check with the Department of Health or the regulating authority that you're going to apply to. If they accepted it, then you can go immediately do your MBA exam and then apply to the residency program. Again, so when it comes to the special condition here, the GPA is going to be 3 or above. For the internship, it was 3.2 or above. If let's say, for example, you did an internship anywhere else and your GPA is 3, you could apply to the residency program. Last year and the year before that, I think the passing score for the Emory to be eligible to apply to the Department of Health in Abu Dhabi was 75%. Right now, I think they lowered it to 70%. So if you scored 70 or higher, you're eligible to apply to the Department of Health. If you scored way above that, then you won't be able to apply. The application will still go through, but by the end of it, they're going to send you an email saying that you got rejected because you didn't meet the criteria of scoring 70 and above. It does not apply for other regulating authorities. You could score 55 and above, and you could still apply to the residency program and the other regulating authorities and get accepted into it. Now, moving on, those are the specialties that is provided by the Department of Health in Abu Dhabi and Al Ain City only, and those are the available hospitals and the number of total seats that is available. So obviously you can see the internal medicine has the highest number of seats. So I would say getting into internal medicine is much more easier if comparing it to dermatology, for example, which has only 2 seats available in only 1 hospital. I would say, like from based upon my experience, try avoiding things as neurology, pediatric surgery, community medicine, and dermatology, since they're extremely competitive and the priority is only given to UAE national. So I would say focus on things such as pediatrics, internal medicine, family medicine, emergency, even general surgery. There's even a good chance of you getting accepted into ENT, urology. I wouldn't say there is no chance of you getting accepted into neurology, for example, but it's going to be extremely competitive and hard. And they only look for extremely outstanding candidates for them to accept them. Now, moving on to the residency in Ahmad bin Rashid University, which is the government sector in Dubai. This is their timeline for admission. It's obviously different. You're going to submit everything earlier in the middle of June when comparing it to the Department of Health in Abu Dhabi. There is also a multiple mini interviews. So it's similar to the OSCE. There's going to be 2 different interviews whenever you're applying to the residency application in the MBRU in Dubai. If you're applying to the Department of Health, they're only going to do an interview asking you about your portfolio and things you have done during medical school internship, and what different kind of publication have you been able to publish. But when it comes to the MBRU, they're going to do you could say a mini interviews similar to the OSCE, where they're going to ask you on you're going to be asked on so many different kind of not a clinical vignette, I would say it's ethical related vignettes. And upon passing this, then only then you're going to be directed towards the specialty interviews. After that, they have their own specialty interviews and their cross-matching. And then on October, they're going to announce whether they're going to get accepted or not directly through your emails. Moving on, those are the academic criteria and documents requested, also as well as the identification documents. Again, I'm not going to go through all of them, but they do request a recommendation letter too. And obviously they should be related to the specialty that you're going to apply to. So let's say you have a recommendation letter that is in dermatology and you're applying for internal medicine, they wouldn't even accept it. So the recommendation letter has to be related to the specialty that you're applying to. A personal statement as well is going to be requested from you guys. And all of those things are not going to be requested by other regulating authorities. It's only in Ahmad bin Rashid University. Now moving on, this is the acceptance rates and the specialty that's offered by the MBRU and their intake capacity. You can see it's extremely low when compared to the Department of Health, but that's because there's 2 regulating authorities in Dubai, DHA and the MBRU. So the rest of the seats is in the DHA there. So they split the number of seats and for each specialty on those 2 regulating authorities. Obviously, for neurosurgery, there is only 1 seat available, and MBRU is the only regulating authority that does offer a neurosurgery residency program in the UAE. So you won't find a neurosurgery residency program in DHA, DOH, and EHS. The only one available is in MBRU, and it's only 1 seat. So it's extremely competitive. Now moving on to the registration for the Dubai residency training. It's from the 10th of February until the 3rd of March. Those are the requested document. Obviously, you can see here the requesting ECE. So as I mentioned earlier, there's the data flow and the ECE. You have to do both if you're planning to do if you're planning to apply to all of the regulating authorities. The Department of Health does not request or require you to have an ECE. Data flow is more than enough. But if you're planning to apply to all other regulating authorities, you have to do the ECE as well in order to apply. Now, moving on, those are the specialties offered by the Dubai Health Authority, which is the private sector in Dubai. Now, when it comes to the number of seats or any other inquiries you have, they're really private when it comes to it. They won't answer back any emails. They won't clarify the number of seats that is available for each specialty. So the only thing that you'll know is the specialty and duration of specialty whenever you're trying to apply. Now, moving on to the last regulating authority for the residency program, which is the EHS. Now, again, as I mentioned earlier, you'll have to do data flow verification and ECE for all regulating authorities. Now, only if you're planning to do your residency program, not the internship, only the residency program. In the EHS, they'll request additional verification form from the UAE Embassy of the issuing country, Ministry of Foreign Affairs in UAE, and Ministry of Education. This is the only regulating authority that's going to request additional verification for all of your documents, the transcript, bachelor degree, and so on. If you're planning to do a residency there, then you'll have to do those verification. You have to verify all of the documents through those embassy and ministry. Now, also they're going to request 2 letters of recommendation. They're going to be related to the specialty that you're going to be applying to. Now, the EHS is similar to the DHA. They don't answer, or they don't really clarify on the number of seats that is available for each specialty. But you can see listed here on the right bottom corner is the specialties that is offered by the EHS, ENT, family medicine, pediatrics. There are so many, but those are the only specialties that is offered by the EHS and the hospitals that is in charge of those residency program. Now, the thing is, when it comes to the announcement for the registration, EHS announces this every March, every year on March, but they don't give you an exact date. So you'll have to go there at the 1st of March and just keep refreshing the website just to see when they're going to update the registration timeline for you guys to apply. Now, I would like to talk about something which is extremely important. Why do you even apply, why do you even should apply to medical residency in UAE? It's only for 3 most important reasons. And the first one is it's a paid residency program. So when it comes to the payment, I would say it's really up there with other countries such as the US. The payment is extremely good. When it comes also to the boards that they offer. So let's say, for example, you did your residency program in the US, you're going to be board certified from the US only. But here in the UAE, whoever graduates from any residency program, he's going to be multi-boarded certified. So the 2 boards that you have to complete in order to graduate from the residency program is the Emirati board and the Arab board. Now, obviously, there are other hospitals that even offer more when it comes to the board. So, for example, if you got accepted into Sheikh Khalifa Medical City and the Department of Health in Abu Dhabi, they offer the Canadian board. So you're going to graduate with Emirati board, Arab board, and even the Canadian board. Let's say, for example, you got accepted in Saudi German hospital in Dubai. You're going to graduate with the Emirati board, Arab board, and even the German board as well. So this is extremely good whenever if you're planning to do a fellowship in any other country. It's going to be extremely beneficial for you guys to do a residency program in those hospitals. And the last thing is that the pathway does not cost that much if you're comparing it to other countries. So let's say if you're planning to do your residency in the US, it's obviously going to be way more expensive. But whenever you're trying to do your residency program here, it's going to be less expensive when comparing it to other countries. And I've actually summarized all of the total costs for you guys. So you can see the first thing that you're going to pay for is the data flow verification, and the ECE is going to cost 1,000 to 1,400 dirhams for the data flow. ECE is going to be 255. The Emory exam is going to be 1,000 dirham, excluding the taxes. With taxes, it's going to be 1,062. You're just going to pay a fee application. So, for example, if you're applying for the internship application, a fee of 222 dirhams. For the DHA, a fee of 200 for the EHS application. MBRE is going to cost you 250, and the DLH is going to be free of charge. When it comes to the residency application, obviously it's going to be much higher for the application fee. For MBRE, it's going to be 650. DOH is going to still be free of charge. EHS is going to be 600, and DHA is going to be 602. So the total estimated cost is going to be anywhere from 5 to 6K. It depends on the amount of papers or documents that you're going to be verifying, as well as the regulating authorities that you're going to be applying to. Now, going back to the thing that I would like to highlight in this presentation, which is the tips that would help you match into the internship or even the medical residency program here. So I've divided those things that they would look for in an applicant into 3 different main categories. So starting with the internship, the most important thing is the GPA. So the first thing that they're going to look at is your GPA. The higher the GPA, the much better, obviously. So this is the first thing that or the first criteria that they're going to use when comparing you to other applicants and whenever they're trying to rank you. Now, when it comes to the portfolio, it's not, I wouldn't say it's extremely important for you to have many publication or research activities as well as volunteer experience or even poster presentation. There are so many people that actually managed to match into the internship program without any of those things because of how well they did on their interview. I would say after the GPA, the most important thing is how well you do in your interview. Obviously, the portfolio would help you showcase so many different skills in the interview, but I would say the interview is much more important than the portfolio. To conclude it, the internship, try scoring as much as you can when it comes to the GPA before graduating, because it would help you greatly to secure a position here in UAE if you're applying to the internship program. Now, when it comes to medical residency program, you can see it's quite different. The GPA is going to be 35 percentile. The residency entrance examination is going to be 35, and the portfolio is going to be 30. I would say, based on my experience and the experience of many of my colleagues, I would say 90% is going to be for the residency entrance examination. I would say even they wouldn't even look at the GPA when it comes to applying to the residency application form. 90% is going to be for the Emory score. I would say 8% for the portfolio, and maybe only 2% for the GPA. Because whenever you're applying to the residency application form, the first thing that's gonna help you secure an interview is your Emory score. So whenever the program director is going through so many different applicants, the first thing he's gonna notice is your Emory score, and in accord to that, he's gonna send you an interview. If you scored really low, there's still a chance of you getting accepted, but scoring high is gonna help you secure an interview spot. And if you secured an interview spot, only then the portfolio would help you in showcasing your skills in the interview. GPA, I would say 2%, even less. They wouldn't even look at it when it comes to the residency, but it's going to be extremely helpful for you guys to secure a spot for the internship. Now, just 1 minute, going back here, I would say, yeah. Before just we wrap everything up, just I've included my email and LinkedIn here. Please feel free to reach out if you have any questions, need guidance about the internship or residency process. If you'd like any additional guidance regarding the pathway for residency, I'll be happy to help wherever I can. So this brings up the end of my presentation, which is the road to medical residency in the UAE. I hope this session gave you a clear understanding of how to start your journey from the internship to residency and eventually becoming a licensed physician in the UAE. I'd like to once again thank the Global Society of Medicine and Health and all of you for your attention and participation. Now I'd be happy to take any questions or clarification you may have about the application process. Thank you, guys.
Thank you, Dr. Ahmad, for this amazing presentation. It was really interesting and really helpful. For anyone listening, if any of you have any questions, please, if you can raise your hand and ask your question. Because if not, I have a few.
Yes, I have a question, please. Okay. First of all, great presentation. Thank you very much for the valuable information. I just have a question regarding the internship for Abu Dhabi. So yes. Can I apply with my 11th semester transcript in order to catch the batch which is going to start in August?
Just one question before that. The program is 6 years that you're currently doing, right?
Yes, the University of Georgia, Tbilisi, yes.
Yes, you could. But in order to be accepted, you'll have to get something called a provisional certificate. So what's a provisional certificate? It's a certificate that ensures that you're going to graduate, let's say, on let's say August of next year, and you're going to be able to provide them with the full transcript, and the bachelor degree, and it has to be signed, obviously, from the university. If you can manage to get that, then it's fine. You can apply with the transcript on the 11th semester. It's fine, no issues at all. But just to make sure, it has to be titled a provisional certificate. I'm just going to type it right here on the chat.
Okay, professional certificate.
Yeah, no, that's not a professional. It's a provisional. So I'm gonna write it. So this has to be the title, on the certificate. Any other document, they won't really accept it. So I'll just write it right now.
Okay, and then
after that, you could apply easily, and they would accept you, no issues at all.
Okay,
you don't have to apply the bachelor degree or the final transcript for you to get accepted. It's fine.
That's good. Okay, but I still need the ECE and the one that you talked about, the data flow thing.
When it comes to the data flow verification and ECE, you're gonna do that within the application form. So let's say, for example, the application started on the 1st of March. There's gonna be a link directly on the website when filling out all of the documents, and it's gonna take you directly to the data flow website, and you're gonna fill everything there, and they're gonna take it from there, and they're gonna verify everything for you. So it's fine. You don't have to verify it on your own. The DOH is going to send you an email, and you're going to submit all of the documents, and then the data flow is going to verify everything.
Amazing. So this is for the data flow. About the ECE, it's the same thing, or like
ECE only is a verification only for Dubai and EHS. So you don't have to do it if you're planning to do your internship in the Department of Health in Abu Dhabi.
Okay, got you. Yes, so ECE is not needed for Abu Dhabi.
It's not needed for Abu Dhabi. It's only for Dubai and EHS.
Okay,
they're gonna request both data flow and ECE, not ECE alone. So you have to do both.
But that's for Dubai and the other Emirates. But for Abu Dhabi, it's only
for Abu Dhabi. It's only data flow. That's it.
Okay, so it's within the application. Okay, and sorry about the GPA. You said it should be 3.2, right?
Yeah, 3.2 or higher if you're planning to do your internship in the Department of Health in Abu Dhabi. If it's residency, it's gonna be only 3.
Okay, but this applies to all years of studying, or is it the CGPA?
No, it's gonna be the final GPA that you're gonna graduate with.
Okay, so the final GPA.
The final one only.
Okay, that's good. Okay, all right, and let me just remember. So, and one last thing about the Emory exam. So I can take it while I'm doing my internship, right? But if you have an idea about the question banks, if there are any special question banks for the Emory exam that I can use while I was planning for my...
I'll explain this briefly. So when it comes to the Emory exam, I would say the most important thing, or the most important resource to use, is the question bank. So there are a lot of different past papers for the Emory exam. I think it's from 2003 until now. So there are so many different questions. I would say this is the most important thing to focus on whenever you're applying to the Emory exam. There are some other resources you could use, such as the Step 2 CK book, or there are so many different other books you could use. But I say the most important thing to focus on is the question bank. I could provide you with a Google Drive with those questions if you'd like.
Yes, please. Thank you very much. Okay. Yeah. All right. So that would be it. Thank you very much.
Thank you. Thank you.
I do have a question.
Yes.
First of all, thank you very much for this presentation. Second of all, you have mentioned that if I want, for example, to use Saudi German hospital as for my internship, and I can get the German board as well. What about if I want to, what if I want, for example, to practice in US and I don't want to go for the USMLE steps in order, cost-wise? Is there a way I can practice in US via UAE?
No, you wouldn't be able to do that. So let's say, for example, you want to do your residency or internship in the UAE, and then you want to transition into the US. Is this your question?
Yes.
Okay, you wouldn't be able to do that because it's two different ways, or the structure of how the residency program internship here is different from the US. So, for example, in the US, you'll have to do both step 1, step 2, and get ECFMG certified, and only then you can apply for the match in the US. And once you get accepted, the first year is the internship year, which is within the residency program. So let's say, for example, you're doing you got accepted internal medicine in the US. It's going to be 3 years. The first year is going to be counted as internship, and then the second year and third year is going to be the residency. It's way different here in UAE. You're going to do an internship here separated from the residency program. So after finishing the residency program, you have to submit an application for the residency program all over again. So you can't connect them. They won't even accept the internship from UAE. To be able to do your training or complete your training as a resident in the US. So it's way different. You can't, I would say, bypass the structure of the program in the US.
Okay.
So yeah, so you still have to do the USMLE if you want to do your training in the US.
Okay. Thank you very much.
Okay.
I wanted to ask about the attestation for the documents.
Hassan, I heard just a minute. Sorry for interrupting.
Oh, yeah, sorry.
Because Abdurrahman asked a question in the chat. So
in the chat, just 1 second.
Is
there a GPA requirement for Dubai internship? No, there is no requirement. The GPA requirement for internship is only in Abu Dhabi. Abu Dhabi is the only regulating authority is going to ask for 3.2 or higher if you're planning to apply there. But if you're planning to apply to EHS Dubai or even MBRU, there is no GPA requirement. You can still apply and match.
Hassan, go ahead.
Yeah. So I know there's a time crunch issue from when you graduate and when you have to start. So for example, if you match, I know you need to get your documents verified, and sometimes there's no time to get them verified and you have to drop out. Do you know what the attestations and everything you have to do?
Yeah, that's what I mentioned earlier. Yeah, that's what I mentioned earlier. You don't have to do anything. So you don't have to do anything. They'll take care of everything. So whenever you're applying on the website, the application form is going to be there. Within the application form, the data flow is going to be there, and like a separated link for the data flow, and the ECE is going to be there. So you're going to go through that link and fill out all of the documents, and they're going to verify everything for you. This is only if you're planning to do your medical training here in UAE. Anywhere else, obviously, you'll have to do something else. It's going to be quite different. But in UAE, data flow and ECE is going to take care of everything. You don't have to do anything.
There's no difference between, for example, like if you apply as a student and then you graduate the same year, they don't need updated documents on data flow or something like that?
No. They won't ask you for it. It's fine.
Okay.
Yeah, it's fine.
Okay.
Whatever you applied with is going to be more than enough. Let's say you applied like 5th year. No, I mean 6th year. The documents you applied with is more than enough for verification. It's just to make sure that you actually graduated from the hospital. Oh, you mean the university?
Okay, I see. Yeah. All right, thank you.
Yeah.
Muhammad, you can go ahead.
Yes, hello. Can you hear me?
Yes, I can.
All right, so thank you, Ahmad, for walking us through the whole journey. It's very clear. Just got a couple of questions. First of all, I was asking regarding for the people who took the USMLE, would it be an advantage for them to include it in their application? Or I've heard that from a couple of people that it's a disadvantage.
Actually, it is. They don't really like applicants who did USMLE or any other exams for other countries. Because the issue is whoever did the USMLE, let's say step 1, step 2, and is planning to do their internship or residency in UAE, there is a huge chance of them getting accepted later on in the US. And they would drop out and go to the US. And they're trying to avoid that as much as they can. So whenever you're applying for an internship or residency program, don't mention that you have done any of those exams. Even if they ask you during the interviews, just say that you're not really interested in doing the residency program or internship in any other country, and you haven't taken any other exam. So if you mentioned it in your resume and or even in your interview, most likely you wouldn't get accepted.
All right. Okay. Thank you. Just one more thing. Does doing an internship for a specific hospital, does it for example, guarantee or raise your chances of getting accepted into residency in the same hospital?
Yes, obviously it wouldn't guarantee a spot there, but it would obviously increases the chance of you getting accepted there, especially like if you are training with the directly with the program directors that are in charge of the residency program. For example, in my case, I did my internship in Burjeel Hospital, and I got accepted in Burjeel Hospital as well for residency program, since I had my experience, since I had been able to work with those people, you know, and the program director directly. So this increased my chance of getting accepted. But it wouldn't guarantee a spot for you there.
Okay.
You can, like you can still do your internship somewhere else and get accepted here. And someone else could maybe do their internship in a specific hospital, and he wouldn't be able to match at the same hospital. So it honestly depends, on the program director.
All right. Thank you so much.
Welcome.
Dr. Ahmed, there is another question in the chat. It's about getting accepted for residency. Does the person have to do the internship in the UAE or in a different country?
Let me check.
By Mu'taz.
Mm-hmm. Let me check 1 second. I can't see it. Can you read it for me?
Yeah, sure. So it says about getting accepted for residency. Do they have like to do the internship here in UAE, or can they do it in a different country?
No, it has nothing to do with the acceptance. So you could do your internship anywhere else and still match for the residency program here. It has nothing to do with the acceptance rate, for the residency program. But you have to make sure that whenever you're applying to, let's say, for example, regulating authority here, you have to make sure that they will accept the internship certificate that you have done anywhere else. That's the most important thing to do and to make sure of. You can do your internship anywhere else and still get accepted here. Just make sure that they will accept your internship certificate here. And to be able to do that, you'll have to directly, contact the regulating authority that you're planning to apply to.
Sure. Abbas also said, thanks for the conference. Can I ask what sources you personally used for the Emory exam?
So when it comes, again, the most important thing to study from is the question bank. There's a huge question bank for the Emory. It's the most important and useful thing that you're going to do for your Emory exam. Obviously, you can do so many other things, such as studying from Step 2 CK. I think there are even question banks from AMBOS right now, I think, in regards to the Emory. But still, the most important thing that you'll have to study from is your question bank and past papers for the Emory. If you can just give me like a few minutes, I'll post them here on the chat.
Sure. Anyone else? Okay, looks like no one else. I
have a question.
Yes.
Yeah, go ahead.
Thank you for the great presentation. I wanted to ask, what kind of skill enhancement courses do they value the most?
What kind of courses? Excuse me, come again.
Skill enhancement courses do they value the most?
I think BLS, ACLS is the most important 2 courses that you would take. There are so many other, related to maybe ECG interpretation, even the usage of ultrasound. But I would say the most 2 important thing to make sure that you submit within the application form is BLS and ACLS.
Thank you.
Welcome.
Also, Abbas asked, do those questions come repeated by any chance?
Actually, there is. So I think I would say on each exam, you'll have at least 20 to 30 questions that were repeated from previous years. But honestly, it depends, some people, they won't even get any of those repeated questions, and some people will. So it's purely luck, I would say. But you can still have those repeated questions on your exam. So that's why I would say it's extremely important, to go through all of those questions and memorize them, because you never know which one might come on the actual exam.
Also, Muhammad Junaid is asking internships from which countries are accepted by the medical governing authorities in the UAE?
Actually, I have no idea which country are accepted by the by medical authorities here. You'll have to directly ask, the regulating authority that you're planning to do your internship in or residency in. Excuse me. So there's no way of knowing unless you ask them. I could even attach, the emails for all of those regulating authorities. You could just email them and they'll respond back saying whether they accept it or not.
Yeah. Also, Razan Othman is asking for BCLS and ACLS. We can do it before graduation from the university.
Yes, I would say the best time to do the BLS and ACLS is at the end of your medical school, because they're only valid for 2 years, and they're gonna ask you for it if you're applying to EHS residency program again. So let's say, for example, you're planning to do your internship next year, so do it before graduating, so that it's still valid for the year that you're gonna do your residency in. So the best time, I would say, before graduating, like 2 months prior to graduation, is the best time to do BLS and ACLS.
Okay, sounds good. I also have a questions.
Yes.
Since we're all here in the meeting, medical students, what advice would you give all of us in terms of medicine, residency, or internships, in terms of everything?
Obviously, honestly, I would say the most important thing, since you're still in medical school, is try focusing on your GPA as much as you can. Just make sure that you can increase it as much as you can, because this would obviously increase your chance of getting accepted for the internship and later on for the residency program. Try engaging in so many other research activities. You don't have to publish, okay? It's not important. There are so many of my other colleagues that got accepted into residency program without even publishing one paper. Publication isn't extremely important. Just being able to engage in some research activities is more than enough. Focus on doing your BLS and ACLS prior to graduation. I would say 2 months before graduation. Also, try engaging in some volunteer services, a blood donation service, a community wellness activity. I would say having one or two of those is extremely important for your portfolio. Other than that, the most crucial thing for the residency program here and to be accepted in it is the Emory. Just be well prepared. Don't rush the exam. Just take your time. As soon as you're prepared, just go apply for the Emory exam and then for the residency exam and for the residency application, hopefully.
Sorry, yeah. Also a question by Muhammad Arif. Thank you for the detailed presentation, doctor. For internship, do we require any visa or Emirates ID, or will it be sponsored by the hospital later once selected?
No, you actually can apply without having an Emirates ID or a visa. But in case you get accepted, then you'll have to they'll help you with the application for the visa, but still, you're gonna still pay the full amount for the visa here in UAE and the Emirates ID. They're only sponsored if you're applying for the residency program. So if you got accepted into the residency program, then they'll sponsor the whole thing. But if you're applying for the internship program here, they're gonna guide you through it, but still you have to pay everything.
Sounds good. Anyone else? Okay, I think no one else is asking. You're just gonna send.
Yeah, I'm gonna send first of all direct links for the website to apply, like for internship and also residency. So just really quick, I'm gonna send those.
And then we can conclude it.
Yes. So this is a link for each of those regulating authority for the internship that I just sent right now. Now I'm gonna send the ones for the residency. This is for residency. Also, I mentioned you guys wanted the question bank for the Emory. Send it right now. So I have a Google Drive that has almost everything explained for the question bank and the things that you have to study. So there's a huge blueprint for the Emory. I'm gonna paste it. No. You can see, yeah, you can easily. And you guys wanted also, second. This is also the provisional certificate. This is the kind of certificate you'll have to get in case you applied and you still haven't graduated from medical school yet.
Okay, got it.
Just let me know if there is anything also needed that I've missed.
There is a question also by Muhammad Arif. He said, are they strict on the age criteria for residency? If suppose you turn 29 or 30 after completing the internship?
I think it's fine. I think the age is up to 37. So you still have a chance. You can still apply. It's fine. Yes, I'll drop both the LinkedIn and the email here in case you guys want to.
From everyone, anything else? Any questions? Okay. Maria Muhammad is asking how to apply for electives in UAE as a medical student. Is it the same as observership?
I mean, you could apply for, no, obviously it's two different way of applying. If you're applying for an elective or an observership, it depends actually on where you're planning to do your observership or elective in. So you need to give me the name of the hospital you're planning to do your elective in, or at least the Emirate. Let's say, for example, Abu Dhabi, Dubai, EHS, where exactly do you want to apply? It's Dubai, so you'll have to obviously go to the hospital. For Dubai, there is no link available for, let's say, a specific hospital you want to apply to. You'll have to go to the hospital itself, to the academic coordinators and the medical education section of the hospital. And only then they're going to ask you for some documents. You're going to provide them. And I think you do pay 2,000 dirhams for 1 month of elective in any hospital here in UAE. And then you can start. But for Dubai, you have to go to the hospital itself. To the academic coordinators there in the medical education department, and they'll tell you exactly what kind of documents do they need for them to accept you for an elective or observation. Welcome.
So, thank you so much, Dr. Ahmad Jamal, for this very inspiring session, and thank you everyone who joined us today. It's always inspiring for us to have like student doctors and everyone sharing their experience and sharing like all their stories together, so we can like learn from each other. That's exactly what the GSMH goal like and what we're standing for. We hope this discussion helped you better understand the path toward medical residency in the UEA and maybe inspired some of you to take that step yourselves. A special thank you as well for Marwan for being with us today and for his continued work and dedication within GSMH. Your efforts truly help the initiative grow and reach more students around the world. And don't forget to follow us on LinkedIn, Instagram, and check all our next posts for the upcoming webinars. Once again, thank you everyone for being part of this growing global community. And thank you, Dr. Ahmad, for your time and generosity. Have a great evening, everyone, and bye-bye.
Thank you, guys. Thank you.